Welcome to the Spark Conversations podcast. Bienvenue au balado Spark Conversation. Brought to you in a mini-series format, enabling deeper dives on issues that matter to children's healthcare systems. Through the ripple effects created through podcast conversations, knowledge sharing, collective action, and advocacy, Children's Healthcare Canada aims to advance innovative, accessible, equitable, integrated, and purpose-built systems of care for children, youth, and their families. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin and Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to forging new and deepening existing relationships with First Nations, Inuit, and Métis peoples. Children's Healthcare Canada would like to thank the IWK Health Centre for their generous support of the Spark Conversations podcast series. We are grateful to Child Bright for their generous support of this episode. It enables us to share these important conversations to inform children's healthcare system improvement. The Child Bright Network is a pan-Canadian research network dedicated to improving the lives of children and youth with brain-based developmental disabilities and their families, bringing together researchers, clinicians, policymakers, and people with lived experience. Child Bright advances patient-oriented research, knowledge sharing, and innovative care to help create brighter futures for children and youth with disabilities across Canada. Enjoy the podcast! Bonne écoute!
I'm Paula Robeson, and it's my pleasure to introduce this mini-series, Childhood Disability and Healthcare System Improvement.
Thank you, Keiko. So the Bright Pathways project is supported by Child Bright. So in this project, our main goal is to adapt the recommendations that have been developed in the United States for the neurodevelopmental follow-up of children with congenital heart disease to our Canadian context. So we're looking at doing consensus groups so that we hear from all of the interested parties and put forward recommendations that take into considerations all of the different barriers that families or systems can face. And as part of that project, we're also developing a risk calculator. So we're using a large international database with more than 3,000 neurodevelopmental evaluations to have a more evidence base to prioritize like who needs the most developmental follow-up.
who go through
So
a
developmental
congenital
follow-up
heart
is
disease
when
at birth,
the
and how does it
medical
work?
professionals will follow the kids over time to see if there's any issues with their development, and it can take different forms. So in the statement for congenital heart disease and for the Pediatric Association, so it's divided into surveillance, which is mostly informal, asking parents questions. There's screening that's done through questionnaires, and there's formal evaluation. That's a full battery of tests that can take up to an hour and a half when the child gets older.
Again, so that's really helpful context. So let's talk a bit more about why do we think that children who have a congenital heart disease
For children with congenital heart disease, again, it's very similar to other populations that often get more regular care than they do. But what happens is that when the brain is very young, it creates a lot of connections, and then it gets rid of the one that it's not using for efficiency. So in those early years, so often the first 2 years, there's a high like possibility for brain plasticity. So if there's intervention at that point, we can change the way the brain is organized to give the children the best chance of having a good developmental outcome. So that's why we really want to capitalize and make sure that everybody that needs the follow-up at that point receives it in a way that they don't have to fight for services or advocate for themselves. But even later on, when we've passed that window of opportunity, there's still possibility for brain plasticity. There's also possibility to provide support when there's no remediation that's possible, so that the challenges don't become overwhelming in daily lives.
So with that, from what you're describing, it looks like there is, of course, a significant burden on families. And but does that also mean that some children, depending on their family configuration, depending on where they live or other aspects, they might receive a different type of care, a different type of follow-up that might be available for them when comparing to other
That begins
children who
touching
might have
on
a
some
different
of the
context that they've
determinants of health
inserted?
that actually affect who gets the care. So if it's systematic, and that's what we're advocating for in our studies, like when the care is systematic, then we make sure that we really capture, and then it's evidence-based. We make sure that we really get the kids who need it the most and not the ones who have the resources to advocate. So right now, the ones that are further away from the hospitals or don't, don't have one parent that can just stop working to do this, or doesn't know about everything, all of the services that offer, becomes at a disadvantage. So it's kind of a double disadvantage because these children we know are already at a greater risk of developmental delays.
Right, thank you, Marie-Ève. And also, I'd like to bring me to the conversation. So you've been involved with Child Bride as a youth partner and have contributed your lived experience to this work. Could you tell us a little bit more about your role in the project and why do you think youth voices are so important in research like this, and also when we think of informing the healthcare system? And so, can you tell us a little bit what is your experience? What is your lived experience of congenital heart disease? What do we know about that, and how that has contributed to your contribution now as a young person to research?
Feel like it was kind of like a shock, like at first I didn't really understand or know much about my diagnosis, because my parents would just kind of like talk to the cardiologist and just, say it all for me. Um, and then my first appointment in adult care, I was kind of like, they were like, "Oh, so what's your diagnosis?" I'm like, I don't know. So I kind of had to learn um about that, and I recommend for people to, like, patients to know their diagnosis like while they're still in like childcare, um because then when you get to adult care and somebody asks you, you're not going to be like shocked like I was. You'll be more prepared. Yeah, another challenge that I came across is the organizational differences. So I find that children's hospitals are actually a lot more organized when compared to adult hospitals. Um, like when I was trying to get my first appointment in adult care, I had a very hard time, honestly. But like with sick kids, they would just like mail the letters. They would like have the dates like written down on a piece of paper and they would just mail it to me, and I would like we would get it from the mail, and it's just like, "Oh, you show up then." Like it was so like laid out and planned. And now I kind of have to work around like my higher education, like university, um because I can't really just skip classes like I used to go and receive the care that I need.
in helping you navigate and should be copied or should function as models?
Yes. So when I was at Sick Kids, we received a transition to adult care package, and my cardiologist kind of like talked me through it on my last appointment. Um, and my parents, obviously, they were like, a great support system. But like from a healthcare standpoint, um, yeah, like Sick Kids was very great at preparing. But I also transitioned into adult care in 2020, so I also had the COVID pandemic and all that fun stuff thrown in there too. So it was a little bit different for me, I would say, than a average experience. Um, yeah, and Toronto General also provided a like a webinar type thing for me to kind of like meet the care team there, but I didn't actually meet my cardiologist. I met another cardiologist, but not mine. Um, but I did really appreciate that, and I think that that was something that they did really well to help to prepare, even though it was very hard to socialize during
It
that
seems
time.
that this familiarity with the system and having contact people that you know and can trust in is essential in any meaningful process of care. Um, and so we do know also that families and then young people are the ones living with the long-term realities of those fragmented systems, right? So in the school systems, I'm sure like when you're transitioning from one to the other,
I think that again, like projects like this, they are good like practices, and they're kind of like leaning towards maybe like inspiring further.
So that prepares both the parent and the teenager for that next step. So the parent to let go and the teenager to take responsibility of the care. Some places have groups where the teenagers can support each other. So there's really a lot of different practices. But I think what's really important and common across many of them is that shift in responsibility between the teenager and the parent that should happen gradually so that both sides are comfortable and know. And exactly like Maya was saying, know their diagnosis, know what they should be talking about, and for the parent to feel comfortable that their child is taking that on, but also kind of that gradual shift. Some of them, they also have the cardiologist, the adult cardiologist, coming to some of the pediatric visits earlier on, so really trying to foster that connection at an earlier point in time. I'm not aware of the programs and how they've
in
been
your
developed,
opinion?
but I know we don't ask families and youth enough. And there is no, like, I think like having evidence-based programs is essential. I think that's where we need to start. We can't just, develop programs based on our anecdotal evidence. So I think that collaboration between research and practice needs to grow stronger, but youth and families need to be involved in every step. There is no way that as researchers we know what it will work, what youth needs, what family needs. So we need that expertise to complement the research expertise that we have, so that the solutions are sustainable, are feasible, are acceptable, and just overall work. one of the main things that we should be working on is having a systematic approach, because when people that need to advocate for the care that they need, that will always create discrepancies. So having an evidence-based approach to who's being followed up and who, like, how do we get the people back, do we have like regular checkup that that we ask the families what they need, what the challenges are, so that we can bring them back, like us as healthcare professionals in the healthcare system, to make sure that we offer that care, and we don't wait for people to advocate and have to navigate the care that they need. I think that's one piece on a system level. And the second piece is having care that's closer to the families. So having, things that happen in the community, either by the pediatrician, as or even, in the daycare settings, in the school, having all the resources, but communication between the school system and the healthcare system. We work in silos so much, but I think if we work together, we'll be able to identify the kids who really need our support and bring them back into the system without waiting that it has like a more substantial impact. Because what happens right now is, if we kind of, if the children fall through the crack because they didn't know about the services, what happens that we only catch them when the needs become so big that it has become overwhelming. Maybe they'll have to repeat a year at school. They'll have like mental health challenges. So we don't want to wait until then, because nobody like, that costs everyone. It costs the family, the child, the system. So we want to make sure that we're there early, and then we bring them back to answer all of the needs that they have. So I think in Canada, we haven't done a lot of work around that. I see in the US, they have educational aides in the hospital, or educational liaison, that do like the kind of for children that were hospitalized, or just to explain some of the educational needs. So they have people within the hospital that have that role to do the connection between the healthcare system and the education system. I haven't seen that in Canada yet. It is part of my future projects to try and break some of the silos. I also think that there's very good opportunities in the daycare system, where we could offer some more like group interventions, or like close to home interventions. The educators are very knowledgeable in child development, and they see the kids on a daily basis. So like having that type of collaboration to raise flags, also send from the healthcare system, send like brochures or just information on what to look for, what that why that child might be more at risk of delays. That kind of communication, I think, needs to be more systematic as well.
Not really, because back then my parents were the ones who would manage all of that. Like they would basically like I would just get the appointment date and I would kind of just, leave school. I was like, "Yeah, day off." Um, um, yeah, I didn't really miss like I was fortunate. I didn't really miss too much school because my surgery was done earlier in life. Um, so I really wasn't like I didn't miss so much, but I did have like those educational difficulties and the stress of sometimes like leaving for the appointments and like, oh, well, what am I going to miss during the day and that kind of thing.
So as we're gearing towards the end, I'd love to hear from each of you. It sounds like different systems are deeply connected, and it's important for families that we understand that systems work as a whole. So, do you think that this connection is recognized enough within our systems? And what do you see as promising practices, or where we should be hopeful to look at? What are the directions, innovations, or family-centered approaches that can help bridging those gaps and building systems that communicate and integrate more systems and provide better care?
As I said earlier, I just think including us, the patients, and our families in the conversation is the most important thing. Like, you can't have the conversations if you don't actually live it.
I
Yeah,
completely
I think
agree. I think
that's
my
my
greatest
message.
hope is that there's, well, first, growing awareness for congenital heart disease specifically, that they need to follow up, because if we compare, I said before, to preemies who have the systematic approach and have a similar risk, those are two similar populations, and one gets the follow up and the other one doesn't. But I think there's growing awareness. I think, and the other point that is very similar to what Maya is saying is, I think there's a growing awareness of the need to collaborate. So before, people would, do their own thing and on their own silos. And I think now there's more, like, we understand that if you don't talk to each other, it's not going to work. So the growing involvement of families and youth, to understand what they need, but also between different sectors, the healthcare sectors, the education sectors, but also, like, what we're trying to do with our Bright Pathways project is to have a consensus group where we have everybody, youth, families, administrators, healthcare professionals, at the same table, and see what are the recommendations that can work in Canada. So that's those kind of collaborations, I think. And it might have been brought, some of it, by COVID, by the fact that now we have all of these platforms through which we collaborate across the country, or even internationally, which we're doing for the risk calculator, using this huge database of 3,000 evaluations from different places in North America to be able to predict a score on a neurodevelopmental evaluation, so that we can have an evidence-based approach to our priorities, rather than just like each hospital deciding in their own way. So I think all of these new collaborations that we've developed over the last, say, like, really, like 5, 6 years, have like really pushed forward much faster than we used to.
Thank you so much, you both, for this very important conversation we had today. I think today's discussion reminds us that developmental follow-up of congenital heart disease, as other conditions of early childhood, this is not about a single assessment or a simple referral. It is a lifelong process that evolves alongside the individual and the family. And while medical outcomes for children with congenital heart disease matter and have improved a lot over the years, it's important to also understand what are the social determinants of health that are surrounding those families. What are the supports that some families are getting and others may not be getting, depending on where they live and what resources are available? What are the coordination? What is the coordination with the education systems and the community care and networks that are lacking or that exist and could be activated or could be connected? And most important, how we involve families and young people and children in building the system and pointing to what is really important and what they need, including participation, mental health supports, and lifelong, across the lifespan, resources and supports for children and families. So, to everyone listening, thank you so much. It was a pleasure to host this episode of the series, and we hope that this podcast will give us insights on how we integrate families, how we highlight the important outcomes for children and families with brain-based disabilities that can help transform the entire healthcare systems for all children. Thank you so much.
Well, that's the end of our time together today. Thank you, Keiko, Mary Eve, and Maya, for sharing your time and expertise with us. Thanks again to our sponsors, the IWK Health Center and ChildBright, for their support. To stay up to date on all of our Spark offerings, including upcoming podcast episodes, please visit our website at childrenshealthcarecanada.ca and subscribe to Spark News if you haven't already. And before we go, show some love for Spark Conversations by leaving us a review and joining us for the next episode. Bye for now.